Way back in 2018, when I started this project, I interviewed a scientist from Genentech, Dr. Sarah Kankari Mitra. She's researching cancer, and I had asked her, what does the future of cancer look like in 10 years? And she hoped that it was that cancer is a managed disease. And now we're 5 years into that 10-year hope. She wasn't predicting it, but she was hoping that's where we would be. Where are we? Are we on pace for cancer to be a managed disease?
I think talking about cancer as a managed disease is exactly the right way to talk about it, because we are not going to get rid of it. It's part of the evolutionary biology of our cells that at some point, some are going to go out of control. But managing it is really quite possible. And what's happened since you first talked to her, I guess, is the tremendous advances in using our immune system to fight against cancer. All these immunological techniques, that's new. That's been very successful. You know, some things have been completely gotten rid of and other things have been controlled, but we're in the early phases of that. And I think we're going to see, if you look at virtually all cancer types, they're not becoming rare in the sense that most cancer types are occurring at just the same rate, but people are not dying of them at the same rate, which shows we're better at managing them. We're better at finding them early on. And once we find them, we're better at controlling them than we used to be. And there is the occasional cure. You know, it used to be that Hodgkin's lymphoma was a death sentence. And now it's one of the most treatable, forms of cancer. So we're making really good progress there. And I don't see any reason that it won't continue, because there are these new approaches, these immunological approaches, and then there's senescent cell approaches. So there's lots and lots of ways. And then we're finding out that cancers are quite often just full of bacteria. You know, you hear about what's called your microbiome, all the bacteria that live inside your digestive tract, right? But there's also bacteria that are living inside the cancers. And it may turn out that by doing something with addressing the mixture of those, we might also be able to do something about managing cancer. So there's all kinds of, one of the reasons so interesting to be a scientist these days is that people are working in these various areas that you've never heard about. And suddenly you realize, oh, wait, this is quite relevant for what I do. And of course, if you do aging, almost anything is going to be relevant for what you do.